Hi Instagram, how are you? It is Dr. Emily, podiatrist, human movement specialist, founder of EBFA Global, and inventor of Naboso. So I wanted to speak about balance training, and 4 balance hacks that I like to use with clients and patients that you're trying to improve their balance. Now, why I like to give these hacks is that when I do balance exercises, a lot of the patients I'm working with have actually impaired balance. So we want to give them tips so that they can win at the balance exercises that we're doing. To do balance exercises with someone who has compromised balance and they're struggling and they keep falling out of the exercise, this starts to cause a lot of kind of the sensation of a failure. It might put them into fight or flight. They might essentially just give up. So we want them, again, to win. So here we go. You're doing a balance exercise with a client, with a patient. It doesn't matter what that exercise is or what that stance position is for them. The first balance hack is going to be using the eyes. So this means that you want to cue them, you want to teach them to use their eyes and stare straight ahead, but they want to really focus on a pinpoint. So they're staring something down, kind of like how a dancer spots when they're doing pirouettes. So the eyes are very much focused versus if you look straight ahead and you see the whole room, that actually decreases the balance. So we want to use pinpoint focus, eyes are centered, and that will help to connect to how we maintain balance. Now, the second balance hack is to use the skin of your fingertips. So the skin of your fingertips is like the skin of your feet, which means that it is packed with mechanoceptors. And those mechanoceptors are sensitive to pressure, stimulation, so the light touch, skin stretch, and vibration. So this means that, let's say we're doing a balance exercise, you can have your client or patient put their fingers together. That immediately improves my balance. You could have the hands on the hips, so I'm stimulating my fingers. You could be touching a chair or touching a wall. That will improve the balance. Or you could put something in their hand. Now, if you put something in the hand, I like to look at what those nerves are sensitive to. So I would have them hold a sticky ball. Like a lot of these balls that are made of silicone, you're actually stimulating the skin stretch. You could use a textured ball that's going to stimulate the mechanoceptors, and then you could hold a ball that vibrates. So you have hypersphere, which is a ball that vibrates. You're getting into those nerve receptors through the pressure and the vibration. Your third balance hack is going to be using tension. So tension is what we create in our fascia when we engage our muscles. So when we engage our core, so I'm engaging my core, what is happening is I'm creating fascial tension. So if I'm balancing and I engage my core, that fascial tension improved my balance. Now, what are some other examples of fascial tension? I could push my toes down into the ground, which is short foot. That's a tension exercise. I could stand and maybe I want to make a fist. So that's creating tension. It improves my balance. If my hands are together to stimulate skin, I could push my fingers together and I just created tension and I actually feel better balanced and more connected when I'm standing here and pushing my fingers together. So there's different ways that you could integrate tension. Go for a cue that works well for your patients or your clients. And then our fourth and final balance tip is to breathe. So you want to make sure that you are keeping that rhythm of the diaphragm as you do a balance exercise. So if you do a balance exercise with your clients or patients and they have compromised balance, they might be scared to do a balance exercise. What happens when we're scared is that oftentimes we hold our breath. So if you hold your breath and you're trying to balance, it will actually compromise the balance. The reason for that is that your diaphragm and your pelvic floor, how we maintain balance, they need to be in rhythm. If we hold our breath, obviously the diaphragm is not moving. So again, here we go, our 4 balance hacks to improve balance and to help those with compromised balance. First, use your eyes. Focus on one spot. 2, use the skin of your fingertips by either touching them or holding on to something or touching a wall or a chair. 3, use tension throughout the body, the core, the feet, the hands. And then 4 is to breathe. Continue breathing. I encourage you to incorporate these 4 balance hacks in any of your balance programming, especially for those that have compromised balance and you're trying to give them tips and tricks to improve the balance to reduce their falls. To learn more about these different balance tricks and how to stay barefoot strong, please visit ebfaglobal.com or nebosotechnology.com. Have an amazing day.